I have been doing fillers for about 7 years now. And the thing about that is every time when a new filler comes up, you get more confused. It all sounds the same. So I did a research on fillers, and I'm here to present them. I'm not standing here for any particular fillers. This is what I believe in and what I've done my research on. It might be complete, it might be exhaustive, it might not be too exhaustive, but due to the time frame of half an hour, this is what I could help you. Hopefully you can decide. As you can look at it, there's 100 over registered fillers, and God only knows how many unregistered fillers there are, especially in a place like China. You have the amazing gel and things like that, which has caused a lot of problems to all of us. In countries like in Asia, a lot of even beauticians or estheticians who are not clinicians, they are doing a lot of fillers, and they've created a lot of problems when the patients come to us. So the 100 fillers today, how to choose? And how do you know who's the good or the bad guys? Because they all look the same. And how can you tell which is the best? Because they all come in nice packaging. And who should you trust? Because it all sounds the same if you just rely on sales, marketing, and brochures. I mean, we are really busy people, and we don't know everything about fillers. Definitely, we do not have the time for research. And then they come with buzzword championships and slogans like Glymatrix, the secret formula, double cross-linking 3-dimension HA matrix, hyper cross-link HA, 100% cross-link or radiant. I mean, it doesn't really make sense to us unless we look into it. And they all come in nice boxes, and you've seen so many of them outside your clinic waiting to see you. And the thing about fillers, they are classified as medical devices and not pharmaceuticals. So, and most of them are companies which are from Europe. So the CE mark does not necessarily require clinical study, because it's done on the basis of a critical review of literature or similar products or materials. So if a precedence has been set, they use that as a benchmark. And can you really rely on that? They all have nice before and after pictures, often image treatments, but these days we have Photoshop, so you don't know whether you can really trust pictures. And most is written impressively, very convincing manner, but not many studies, however. Because the thing is that when the sales rep leave some journals on your table, you don't really have time to read that. The only thing about our patients, they trust the doctor will choose the best product for them. So doctors, as we are the expert, we shall offer the best treatment available. We treat patients safely, and we have the responsibility as long as the product is there. As long as the implant is on the face, on the body, we are responsible for that. So let's take a look at the filler categories around the world. The 3 filler categories are the permanent fillers, which are non-biodegradable, and they last definitely more to up to 5 years, and some say forever. They are claims. They're made out of granules, which are stiff, soft, spheric, asymmetric, or gels. Examples are polyacrylamide, which is Aquamid, silicone oil, hydroxyapatite, radius, or PMMA. One of my gurus in this, when I started years ago, used a lot of silicone oil. And but the thing is, this is not actually advisable for people who, for beginners especially, because it is permanent, and I've seen a lot of cases after that. You can't undo it. Then there's the semi-permanent biodegradables, which is 2 to 5 years. I've used this quite a bit also. Examples are polylactic acid and polyvinyl alcohol. Then the third one, this is what I think especially all beginners should use, is the biodegradable. They could be anything up to 2 years, from months to 2 years, maybe sometimes even a week. Some of them don't even last. So we have the collagen, which is bovine, porcine, or human, I think Humans is the one you have this Isolergen. I don't see the company anywhere anymore. And the best, the ones which you see out there a lot is the hyaluronic acid. Now this is actually this is my favorite, hyaluronic acid. You can have the animal, non-animal. They come in liquid syrups, mix liquid and syrup, cross-link, stabilize, uncross-link. They come in all these things. It's probably jargon to you at the beginning. Sometimes it's lack of definitions. I do not know where to put them because you look at, they have non-biodegradable material in a biodegradable category of fillers. So where do you put them? It's like article, they have rounded PMMA in bovine collagen, and this requires skin testing. So there's Avalon's, which is porcine. Then you have Dermalife and Dermadip, which has PMMA beads in hyaluronic acid, and you have also Metridex HA with dextrans micropheres. Metridex has been taken off in Asia, but I was a very, very big user of that. I used to order about 100 boxes. All the while I thought they were biodegradable, so I told the patient it lasts up to 2 years. But the sales rep did not tell me that it actually has dextrans micropheres, which if it stays in the body, it stays in the face. And where do they migrate to? So, it was just a lack of full knowledge and lack of disclosure from the sales rep. But fortunately, no patients came back with any complications or anything like that. Then there's natural fillers, which you could use your autologous fat, which you do with syringe lipofilling. I thought at one time this was a great idea because you could just take out fat with a syringe. You separate it and inject it into your face to voluminize. But then again, there's only, what's the percentage of uptake? Because this fat might not even take up at all. And what is the duration? Where do you place them? Is it short-term, mid-term, or long-term? But according to some of the doctors who are doing this, they say it's mid-term. But then again, to some doctors, they say it's permanent because if you put it like at the back of your hand to fill up your hand, when the patients put on weight 10 years down the road, she'll have a really fat hand because this fat grows. Or if you put it in the face, there was a picture of that. I don't have the picture here. You put it in the face here, and when you put on weight later on, you have such a big fat face. What do you do? About 2 years ago in Singapore, the father of liposuction, that is Dr. Pierre Fournier, I went there, and what I did was he took a syringe and injected on my face, and it was really horrible because I looked like that, all plumped up, and I was horrified after the procedure. So they told me it was just the inflammation first when you do a filler. So that was fine, but after 3-4 days it didn't go down. I panicked, so I put a lot of steroids and everything. And thank God within a week it didn't take up at all. So it was just the inflammation. So then again, a lot of us have stopped this procedure with autologous fat because you do that procedure, it might take up, it might not take up. The reason I did that, wanted to advocate that was because, in autologous fat, there's a lot of stem cells. So thinking that you could rejuvenate your face with also the stem cells. So I wouldn't advise this now to voluminize your face or to treat deep lines. So the major filler types, you have the permanent products, which are made up of particles and gel. And you should know that how do you remove them? So this is really for the experts. I would advise you, if you want to do it with permanent products, you have to be very, very sure of how you inject and your techniques and things like this, because you probably need surgery to remove them. Most of the companies will teach you, but the things that then you pass it, you got to sometimes refer to another doctor to get it removed.